Hey guys, Wong with Hands-On Therapy Services. So I have Claudia here. She's behind the camera, but she's going to ask me some questions that you guys tend to ask her when you guys call us here at Hands-On Therapy Services. So Claudia, tell me one of the most common questions that you get on the phone.
All right, Wong. So one of the questions that I get a lot on the phone is, what is a rotator cuff tear, and do I need surgery to fix it?
Great question. I do get that question quite often. So a rotator cuff are essentially four muscles, just keep it real simple, four muscles, and one of them tends to get torn more than the others. Now, the question is, what is a tear? Well, what happens is you have the muscle, and then on the ends is the tendon, right? So there's one that goes right here, and the rotator cuff muscle helps to make sure that this bone, your humerus bone, is attached to your body and that your arm can move without pain. Now, what happens is when you have a little tear, you don't have to have surgery, but you have a full tear, it's a great idea to have surgery. So let me explain a little bit about what a small tear is. If you have a small tear, what happens is you have an imbalance and you start moving your arms, doing stuff, sleeping, driving, picking up things, and over a certain period of time, you can develop some shoulder pain. Now, it is completely possible to actually get rid of that pain and get real strong, and not only strengthen those four muscles, but actually we want to make sure that the muscles in the front get stretched out, right? And the muscles in the back of our arms get a little bit stronger to support how you're supposed to be able to move your arms. In terms of can you avoid surgery when you have a small tear? Absolutely. So the sooner you go to get help, and that's the hard thing, right? The sooner you go to get help, the sooner you can make sure you get rid of that pain, but also don't continue irritating that tendon and tearing it further. If you have a full tear, normally when I find out that people have a full thickness tear, that's what it's usually called. First of all, we can see it in the clinic during certain movements or lack of movements. And the other thing is a lot of people come to us with MRIs. They'll ask us like, oh, do you mind explaining to me what this MRI means? And when you have a full tear, it's usually recommended to have surgery. And I usually will give some advice in terms of the protocols and what happens after surgery so that you're in the best position possible. So I hope that question helps to answer any questions you have in terms of what is a rotator cuff tear and do you need to have surgery.